Okay, there it goes. Okay, so I did my family assessment is on the Morris family. And then this is my family composition table. So I interviewed Janet. She's the mother in the Morris family. She has her high school education and she is a bank teller. Todd is her husband. He also has his high school education. He is an offshore worker. Together they have Lily and Ava. Lily is 16 and Ava is 11. Um, the family lives on a like in a relatively small town. They actually live on the same road that Janet grew up on. This is the family genogram. So Janet and her parents and sister, and then Todd and his parents, and then Todd and Janet's two children. This is the family eco map. So Janet described the relationships within her family and outside to be strong, um, such as with her sister and parents, church, neighbors. Janet does go to the gym from time to time, and then Lily and Ava do softball, which they're very involved with. So the developmental level of the family. Um, Duvall's eight-stage family life cycle is a model that assesses the stages of family development, and it includes like the married couple, couples with infants, preschool age, school age, adolescents, young children, middle age, and aging families. The Morris family is on the families with adolescent stage. Lily and Ava are adolescents that can have their own identities by hanging out with their friends and choosing what sports they would like to join, if any. They're able to make decisions for themselves, within reason and expected to help out around the house with chores. For communication patterns, Janet describes the communication patterns as being effective for the most part. Janet describes the family as having open communication that allows Lily and Ava to come to her when they feel stressed or overwhelmed or anything they need. When Janet was growing up, her family was very affectionate and maintained open communication. So because of that, Janet wanted to, try to raise her kids the same way. Janet and Todd have been together for 20 years or something, 20 years, So they have learned the best way to communicate with each other, through trial and error. So power base and overall continuum. So Todd is the primary earner. He does make most of the money that comes in. Um, he is at work for a lot of the time, but when he is home, he does help Janet take care of the kids, um, and makes decisions. Janet, though, she has most of the influence as far as the decision making goes. Janet makes the decisions regarding the children in the home most of the time. Both Lily and Ava are able to make some decisions about their lives within reason. For role structure, so Todd works offshore, so he is at work a lot out of the year. When he is home, like I said, he does help Janet with the cooking and cleaning and things like that. Janet is the primary caregiver of the household, so she makes, all of the decisions. Janet also works as a bank teller at the local bank, and she does go to the local gym from time to time and works out. Ava, she tries to keep the peace in the family. Janet described her as being very sweet and kind. Lily is carefree and at an age where she just kind of wants to be by herself, hang out with her friends. Lily and Ava are expected to do chores around the house. Janet believes that giving them responsibilities is important to growing. With family values, the Morris family value centers around education, respect, and their faith. For this family, education is very important to the children, so that the children can grow and be successful. Respecting each other is very important for this family. And then religion is also a very important part of this family. Both Janet and Todd grew up in a Christian household, so their faith is very important to them. For healthcare, the Morris family views healthcare as not only being physically healthy, but mentally and spiritually. The family does, they go to the doctor's office and the dentist's office. You know, the dentist's office, every 6 months like you're supposed to, and then the doctor's office for just checkups and things like that. Janet receives good care for them, claims that she does, and the family receives health care insurance through Todd's work. Janet has been diagnosed with peripheral polyneuropathy, um, although her husband nor children have been diagnosed with anything. Janet's father does have diabetes and hypertension. Janet's grandmother actually recently passed away from cancer, but she also had hypertension and diabetes. Todd's mother had a heart attack a few years ago, but she did survive. And then Todd's father had diabetes and actually passed away from kidney failure. With family stressors and coping. So short-term stressors for this family is that Janet's Jeep recently broke down, so her car broke down actually on the day that I interviewed her. Long-term stressors for this family is Janet's grandmother passing away a few months ago. According to Janet, it's been hard on the whole family, but really for Janet, because she was very close with her grandmother, it's been a process for Janet and for actually her mother, because it was her mother's mom who passed away. So Janet does say, or the family copes by praying and through their faith. Janet believes that praying gets you through, through it, and she says that the family copes just through open communication and supporting each other. So because of her grandmother's recent death, my nursing diagnosis is ineffective family coping, related to the recent death of Janet's grandmother, as evidenced by Janet verbalizing an increased stress and difficulty coping, along with withdrawal from her normal routine, such as decreased gym attendance. While she normally does go to the gym, she did say that she hasn't been going as often as she used to. So for my goal or outcome with this, I put within a few weeks, Janet and her family will exhibit effective coping by exhibiting at least one positive coping strategy, whether that be talking with the family, walking, journaling. My next one is within a few weeks, Janet will resume participation in at least one normal routine activity, such as returning to the gym. And then within a few weeks, Janet will report a decrease in perceived stress levels. With interventions, assess Janet's emotional response to her grandmother's death, encourage Janet to express feelings about her loss and the changes in her family dynamic, explore current coping strategies and identify which ones are ineffective, provide information about grief support groups or counseling services if needed. So my risk for diagnosis, I did risk for caregiver role strain related to Janet's responsibility as the primary caregiver for her children and her increased household workload, including cooking and cleaning, while Todd is away for the majority of the year. So since Todd is at work for a lot of the year, and Janet has to maintain that responsibility with the children and with the home and still working and everything like that. That's why I chose risk for caregiver role strain. For goal and outcome, I put within a few weeks, Janet will verbalize an understanding of caregiver role strain risk factors and identify at least 2 personal stressors. And then within a few weeks, Janet will identify at least 2 supportive resources, such as family or friends or community programs. Janet will maintain a balanced routine that includes caregiving, household tasks, and then having some personal time too, is helpful. And then for interventions, assess Janet's caregiving responsibility, daily workload, and perceived stress level. Encourage Janet to verbalize feelings about her caregiver role and household responsibilities. Help Janet identify supportive resources such as family members, friends, community resources. Assist Janet in developing a realistic daily routine that balances childcare, household tasks, and personal time. And then teach Janet stress management techniques such as deep breathing, mindfulness, journaling. And then these are my references.